Well, today is World Asthma Day, and South Africa joins the rest of the world by participating in a global campaign aimed at educating the nation about the condition. Although asthma is not curable, the day is set aside for all people suffering from the condition to learn to control it. Joining me now is Dr. Omolemo Kitchen. He's a pediatric pulmonologist who's also vice chairperson of the NAEP. A very good morning to you, Doctor. Thanks so much for joining us. How do we know whether asthma is asthma or it's just a chest infection?
Okay. Thanks for the invitation. Commonly, asthma, you find that patients actually have got symptoms that are suggestive of asthma, which will be usually night cough, cough especially at night, tightness of chest, and wheezing. Kids who are actually put on antibiotics time and time and again, and they don't get better, and they especially have night symptoms and they've got limitation of activity, you must start suspecting that these kids actually are suffering from asthma.
Okay.
In most cases, asthma is missed because it tends to coexist with another condition called allergic rhinitis, which usually people refer to as sinusitis or sinuses. So it's important that when somebody suffers from recurrent infection and is not getting better and getting antibiotic after antibiotic, must go to the doctor or an asthma nurse to check if they've got asthma.
Now, how do you treat asthma?
The most important thing about treating asthma is that asthma is not curable, but you can control the disease. So the way you treat asthma is that you need to use pumps which are called controllers or inhaled corticosteroids. People are scared of using corticosteroids because of fear of side effects, but because these steroids are not taken into the mouth but into the airway, the side effects are actually minimal. So the important thing is that the inhaled corticosteroid has to be taken every day until the doctor or the nurse says so.
Obviously, it's quite difficult. So I've got a 3-year-old, and we're concerned that he's obviously got asthma or his chest infection, or it's on and on and on. It's obviously difficult to try and get that pump into him and to try and get him to actually inhale that pump.
Yeah.
And it's obviously also exercise-based. He only obviously gets it when he runs around. Is there a link there?
Yeah. Well, there is a condition called exercise-induced asthma, which obviously gets worse when the kids exercise. The thing with children is that they are allowed to run around, you know.
How do you stop it?
You don't.
You can't.
You can't. So that is why it's important for them to be on treatment. Now, the problem with the pumps is that in children, especially under the age of 5, they are unable to use the pump without a spacer. So there's a device called a spacer, which you actually attach to the pump, and then you spray it onto the child. So that allows the spray, actually the inhale steroid, the controller, to go into the lungs without a problem. With adults, you can actually teach them the technique, and they can actually do it properly.
Obviously, the use of nebulizers and stuff like that, are those also effective in treating asthma in children?
Well, us at NAEP, and especially specialists in the country, we discourage home nebulizers. And one of the problems is that people tend to use nebulizers instead of using controller medication, which is inhaled corticosteroids. So the better pump to use is called a reliever, which is usually either a blue pump or a green pump, depending what brand you go for. That is used you spray it whenever you have an acute attack of asthma, just to give you a relief. The home nebulizer sometimes, you know, the nebulizer works better in the hospital because you actually use oxygen to help open up the lungs. So we actually encourage patients to rather use the reliever pump than to use a home nebulizer, especially at home.
But it's obviously also what you put into that home nebulizer, or the medication that you put in.
Yes, that is true. I mean, like there are other issues as well. Remember, we don't know what causes asthma, but there's a lot of research going into genetics to see what is really actually causing the asthma. But what we are aware of is the triggers, and one of the triggers is called house dust mite. So if that nebulizer is lying somewhere at home, you don't know what's getting inside it. So by the time you put the muti in there and you nebulize the patient, then you don't know how much of that is actually going into the lung.
You said there's obviously no cure, but do some people grow out of it? Is it something that can go away? Or once you've got asthma, that's it?
It's a chronic condition. There's no cure. There's a lot of misconception about outgrowing asthma. If you really have asthma, and there's strong evidence that you've got asthma, you actually do not outgrow asthma. Your asthma will get better with control. Small kids have some form of airway disease called the wheezy airway disease. So as the child grows, the airway gets bigger, they get better. So those kids, we believe that they actually were never asthmatic. But once you are diagnosed with asthma, you have to be on controller medication regularly. You have to go for regular visits in order to keep the asthma under control. And the problem with asthma is that a lot of these kids are admitted to the hospital, which is not necessary. There's poor compliance, which we can deal with, and it's a fatal disease because people die from asthma, and that's absolutely not necessary.
What you would recommend, but not going to a GP? Can a GP deal with something like that?
Yes, all the way from a general practitioner who knows about the condition, which most of them do, will actually help you. Even our clinic sisters, the asthma practitioners or clinic sisters actually know about the disease, and they will actually be able to help you. The important thing for patients to do is that they should not stop the treatment once they've started it, and they actually need to go back and get review to see whether the asthma is under control or not.
Well, very interesting chatting to you, Dr. Kitchen. He's a pediatric pulmonologist, and he's also vice chair of the National Asthma Education Program. Today is World Asthma Day, so we're just chatting to him about all the side effects of and medication. And it's also what you should do if your child or yourself suffer from asthma. Appreciate your time this morning. Thanks for coming in. Well, let's take a brief look at some of the main stories on the front